riding around the block with a Glock. Yo ass finna get shot. That's the silencer. That's the.
So somebody at work said to me, "Oh, you're actually quite smart for a nurse. Why didn't you just become a doctor?" And I thought about that and I was like, gee, I'm not really sure. So on my day off, I decided to record my life as a nurse and not a doctor. So first thing, I wake up after sleeping 20 hours, very well rested because I never have to be on call. So then my little pea brain rattles around. I think about what I need to do and I decide to get up and get ready. So I do that. And then I have to go to the bathroom and then I realize I'm out of toilet paper. So then I'm like, what to do? I grab my bachelor's of nursing degree because it's literally worth nothing. And I just put that there to use as my next round of toilet paper. So then I walk around my 2-bedroom apartment that I can afford by myself, trying to figure out what I would do with my life since I don't have to go study for 12 hours like another medical student. Super lame. And then I walk past my work name tag and I got super sad because it says RN and not MD. So I throw that on the ground. So then I pick up my Ray-Bans and my AirPods that I got from my work sign-on bonus because they're such in desperate need of nurses. And I just put on some good music and use that to dull out the senses of my ever-going failure that I became a nurse and not a doctor. So I do that for like a while with some wine. And then once I'm feeling better and refreshed, I take off my Ray-Bans and AirPods, and then I'm like, the Bachelorette is on tonight, so I stroll to my nice kitchen and pour myself a fat glass of wine because I don't have to be back at work tomorrow or the next day or the day after that. So yeah, that's my life. Really sucks to be a nurse. Cheers, love you guys, bye.
My favorite mugs for nurses on Etsy. Check out Dank Nurse Boutique on Etsy, link in the description. Nurses be like.
It's really important to make healthy choices when it comes to your diet.
Yeah, like 2 Big Macs, a large Coke, and a large fry.
Asking our non-medical spouses medical questions.
This is going to be fun.
What is edema?
Can you spell it?
EDEMA.
E?
Yes.
Edema.
Edema.
You're going to say that person has a lot of edema in their legs.
Fluid underneath the skin.
Yeah.
Yeah. What is the vital sign reading? SpO2.
SpO2. Like
SpO2.
R2D2. A robotic arm.
It's a vital sign.
Of a robot. No.
Go, yeah. What do you guess?
You just said it was a vital.
A vital sign.
What
does it measure, though?
I can't get Star Wars out of my mind.
Your heart rate?
No.
What is a thoracotomy?
I feel like it's something puncture. What is pointy puncture?
Removing a gag reflex.
What is an IND?
Control. It's that birth control thing.
That's an IUD. This is the IND. It's IND.
It's Model 2. About that.
What is jaundice?
What was it?
It was wrong.
What? No, what is jaundice?
When your eyes turn yellow and when you have to pee, you're yellow.
What is cyanosis?
I don't even remember the spelling of this question.
I have no idea.
You have to guess this one.
Guess something.
Cyanosis noted to bilateral lower extremities.
Muscle failure?
What is a Foley?
Their insides come out of your butt. I know, that's it. Tell me that's it.
Ding dong.
If anyone wants to know what it's like to be a med-surg nurse, I got in a report that my patient can't have a PureWick because she likes to take it out and suck on it. And I was like, what? And they're like, yeah, like a lollipop.
We do not care.
And remember, with a little Rusty's and an insane amount of luck, you too can look like me. Ka-chow.
Hey Greg, how are the baby's vent settings? Well, I was able to adjust the unilateral phase detractors to 35 and the cardinal gram meters have decreased their output matrix to 4245. The last blood gas was good at 72560-256, but the retroencabulator parameters show a slight dip in the magneto-reluctant reactance. I see. The ET tube has an emulated wing shaft taped at 7.5, decreasing aerofabulation. Well, that just makes sense. Yeah, so ungular fumbling is also decreased. Oh, good, that's good. I've set the PEEP to the standard Lotus Void Del type setting. Sure. Now remember, every non-reversible 7th conductor tremor deviation needs to be monitored, so if fluoroscopic score motion is required, be sure they're deployed in conjunction with a drawn reciprocation girdle to reduce sinusoidal deplanaration. That's just what I thought. Okay, I've got some treatments to give right now. You'll be okay relaying this to the doctor? Uh-huh. No problemerino. So how's the baby's ventilator settings? Great! They're great. Why don't I go get the RT? Oh, thank God.
Oh my God! No! It's dark, I think. Did you guys see my cooch and my butt? Say yes if you did.
How many of those did you take? I took 9. Yeah, I did, I think, slightly overcommit.
Next time you want to catch an attitude with me, you can catch it with Jesus, because I'm going to send you to see him, okay?
What brings you to the ER today? My tampon's stuck. How long has it been stuck? A week. Why did you decide to come today? It started to smell and it hurt really bad after sexy time.
You applied first for the Defense Against the Dark Arts post, is that correct?
Yes.
But you were unsuccessful?
Obviously.
Element up with the fucking bodies in it like obliterating everything is iterator renegade. I'm gonna make anybody who want it with the pin and frame it. Don't nobody want it, but they're gonna get it anyway. I'm beginning to feel like I'm mentally ill until.
Have you ever had a dream that you do?
He's going to hop on here real quick and talk about something I have a very strong opinion on. We should never falsify our charting in general, but specifically pupils, okay? Because multiple times in my career now, if I come onto a shift, done my head to toe, and found that my patient's pupils are unequal but reactive, but unequal. And I'm like, okay, maybe this is their baseline. And I go back through the charting, and there's a discrepancy between what's been charted and what I'm seeing. So now the question is this the patient's baseline and it's totally benign and normal and there's no issue? Or is there a brain bleed, aneurysm, stroke that we've missed, something super acute? And you don't really want to put blind faith that people just didn't do their fucking job, right? So then, really anxious nurses like me end up taking their patients to stat head CTs at 2 a.m. for no reason because people just didn't do their jobs right and falsified their charting. Okay, so if you didn't see it, don't chart it. If you didn't do it, don't chart it. Don't falsify your documentation. Please, I'm begging you, my legs hurt. My feet hurt. I'm tired. I don't want to do this anymore. Thank you.
Tell me you're a nurse without telling me you're a nurse.
Sir? Sir? Sir, are you there?
Don't die while there's still life inside of you. Live now. There's plenty of time to die later. Hashtag speaking from the heart.
Ding dong.
Hi, I'd like to cancel my membership. Why? I just don't really need it anymore. We're sorry to see you go. Can you specify? I'm on a budget. Would you like to look at our plans for people on a budget? You can get the entire thing for 50% off of what you're paying right now. That was available this whole time? We'll also give you 2 free months. What do you say? I still want to cancel. If you stay, we'll let you keep your plan for $1 a month. How is that profitable? And if you stay, I'll give you a free gift too. What do you say? I still don't want it. I feel like if you stick someone with a 14 gauge needle, you are not a nurse anymore. I think that you are certified a serial killer. What the frig? Unless your hemoglobin is like 2, I can't.
Hello, my name is Lily, and today I will be your nurse. Hi, my name is Lily, and today I'm going to be your nurse. Hi there, hon. My name is Lily. I'll be your nurse tonight. Hey there, sugar. My name's Lily. I'll be your nurse tonight. Hi, sweet cupcake of love. I'm going to be your nurse tonight. Hi, sweet sugar muffin with extra whipped cream on top. I'm going to be your nurse tonight. My name is Lily. Hi, sweet cherry pie with a little bit of sugar on the crust. How are you? My name is Lily, and I'm going to be your nurse tonight.
When I got tired, I slept. When I got hungry, I ate. When I had to go, I went.
When I tell my patient with coronary artery disease to consider diet and lifestyle changes.
I want my bacon. I gotta tell you something. Bacon is good for me. This is really mean. What? She thinks out of the blue. She's a smart little girl and can do whatever she wants. No.
Bruh, what is it about figs that makes an attractive person, or already attractive person that's in scrubs, just shoot up from a 10 to a 22? Like, an attractive person in regular hospital scrubs already has my attention. But let that same person be in a fresh set of figs? Bruh. Tell me I'm bullshitting. The next time you see somebody in a pair of scrubs and they got that logo and the color's really bright and they got the joggers on, you know what I'm saying? Tell me you don't want them to take your temperature.